7:09 Mornings with Brian, WCRF. You know, we do a lot of things around here. We have fun and do silly things, but we also often try to tackle issues that the church doesn't talk about enough. Mm-hmm. And there's one we haven't touched on very often, and it was actually a heartbreaker for me to find out that our friend Lauren went through this last year. And it's hard to describe, but I mean, honestly, you were going through this during the Renew Women's Conference. Can you talk to us about what happened?
Yeah, so our Renew Women's Conference was last September on a Saturday, and on Monday and Tuesday, I had had a miscarriage. So throughout the Renew Conference, I was still having that miscarriage last year.
Wow. And it's something that you kind of... I mean, did you feel like you could talk about it or not? You were grieving the whole time.
I had told my immediate team at the time, the events team, so that they knew like just where I was at and where my headspace was as we were going into this big event. But I didn't share it, obviously, with the WCRF team at that time. This wasn't something I needed to share with you guys or for you guys to worry about at that time. But
well, it was none of our business unless you want it to be.
Yeah. And so I told you guys later. I was pretty open about it afterwards. Because like you said, I feel like we don't talk about it enough. And every time I talked to someone about it, they're like, oh yeah, my sister or my wife or my best friend or whatever has gone through a miscarriage.
Right.
And I was like, well, then why do I feel so alone? Why is no one talking about this? Why does it feel like I'm the only one talking about this? When all these other people that I'm telling have experienced similar things or know someone who's experienced something similar.
Well, my friend and regular listener to the show, Erica Kurcsak, is here. Erica, you've been through this as well, and you and I have been friends. Sarah and I are friends with you and your husband. I didn't know you'd been through a miscarriage in your own life.
Yes, that's right. Actually, I relate to what Lauren's saying a lot. People just don't talk about it, and I had a very early miscarriage, my first pregnancy. And
heartbreaker, first pregnancy.
Yeah. And then after that, experienced about 1.5 years of infertility. And I did have that sense of just feeling alone. I didn't know anyone else personally that had gone through it, even though, as Lauren said, there's so many people that have. I just didn't know anyone personally. And so I didn't know who to reach out to. And so I felt very alone during that whole time period.
Why didn't people talk about it, you think? And why don't they talk about it now?
That's a great question. I think that there's, it feels very personal, very private. And I think sometimes there's a temptation as women to feel like there's something wrong with us. This is what we are supposed to be designed to do, to nurture and give birth to life. And so when that doesn't happen, there's just this shock and disappointment and a little bit of shame sometimes that can be associated with that, even though there's, it's not anyone's fault. It's just, I think, the way of human emotions, especially female emotions.
Lauren, does that resonate with you?
Yeah, absolutely. Yeah, I think I just felt like, no one really wants to hear about this. This is like kind of personal. It's kind of gross. So who wants to hear about that?
Well, and then the shame part of it's a heartbreaker.
Mm-hmm. Yeah.
I mean, were people making you feel shame in some ways, or something that people were doing or saying, like just generally in life, or it's just the nature of you felt like somehow you had failed?
Right. Yeah, I didn't tell anyone. I mean, maybe 2 or 3 people knew that whole 1.5 years. I kept it inside.
And in my experience, I've obviously clearly never been through something like that. But when something private and tragic takes place, you can feel so lonely. Mm-hmm. Because you don't want to let people in, or you don't feel like you can let people in. And so you have to fake it, right?
Right. Right. You feel like no one would understand.
Wife.
Right.
So there's expectations on you already.
Mm-hmm.
So how did that feel to have to pretend that you weren't grieving the loss of your child?
It was very difficult. And I think a lot of times we were in a small group, and I didn't even share it with the people in my small group. There was another woman in the small group who got pregnant and had the exact same due date that I was supposed to have.
Stop it.
And so the entire time I had to pretend to be excited for her, even though I was dying inside.
Is that one of those where you get in the car afterwards and just start weeping?
Well, it was at my house, So I could just get in my own bed and start weeping. Yeah.
She had the same due date.
Yeah.
How did you navigate that? I mean, was it just something where how do you even put a face on for that?
The Lord was very real to me during that time. It was a very dark time.
Mm-hmm.
And I just remember times laying prostrate on the floor, crying out to God, pleading with him. And, God's grace is just amazing in those kind of moments. He doesn't give it to us until the moment that we need it. And each night I was dreading the group coming, but the Lord is good. He's faithful through that.
Erica Kurcsak is a friend, a dear friend of Sarah and mine, but also, and I've been hoping to have you on the show for a long time. We've just been trying to come up with the right reason for it.
Well, thanks.
She has a bachelor's degree in psychology from Cedarville and a master's in biblical counseling from Westminster Theological Seminary. And the Lord tapped her to use that training and her gifts to reach out and be a support for women who've been through just what you're describing. And when we come back from this break, what we'll do is hear how maybe you're listening to this and you're like, man, I feel alone. I've been through a miscarriage or infertility or the loss of a child in some way. I tell you what, there's a wonderful opportunity through what the Lord is doing in Erica's life for you to get the support you need. And we'll talk more about that in just a minute. 721 WCRF Mornings with Brian. So excited to have in studio with me my friend, Erica Kurcsak. She has got a bachelor's degree in psychology from Cedarville and a master's in biblical counseling from Westminster Theological Seminary. Beyond that, just a friend of Sarah and mine and a listener to the radio station for many years. And we've been chatting about the pain and the shame of going through a miscarriage. I felt like you were alone in the midst of that. And yet, in the midst of this, I remember a number of months ago, you shared with Sarah and me that the Lord was doing something in your life in this area. What was the Lord calling you to do?
Well, actually, a lot of this pain was resurfaced 6 years ago. Last week, actually, I was pregnant with my fourth child and had a very dear friend who was also pregnant, and we were due with baby girls within 10 days of each other. And around 36 weeks for her, she found out that she had lost the baby.
Oh.
And I had never, I don't know if I was naive or what, but I had never heard of a loss that late in pregnancy. And it was shocking and it was terrifying to me. Mm. And I remember just standing in the hospital room with her, praying over her and being so confused and so shocked and not knowing even what to pray. And a lot of the pain that I think I never really dealt with from my initial miscarriage was coming back. And it was almost as if I was losing my baby now at that particular time. And so I remember going home and just the anxiety was super high. And one morning I was praying, because that's what I always did when I was anxious, just turn to the Lord. And I was praying Psalm 121 over my baby for the Lord's protection. And this thought just came into my mind. Why are you praying to a God to protect your baby who didn't protect your friend's baby? And
that's so honest. Thank you for that.
Was he able to protect her and he didn't? Or was he not able to protect her? All these questions I had never thought of in my entire life. These doubts were coming into my mind. And I think that's just normal for suffering.
Yes.
And I think that's part of the shame that people experience. They don't want to talk about the fact that they're having those kinds of questions. So over the next weeks and months, my friend was very honest with just a small community of women of all the emotions she was going through. The anger, the depression, the anxiety, the bitterness, all of those things. And what struck me is that in the midst of all of those emotions, she always turned to the Lord. No matter how hard it was, no matter how angry with the Lord she was feeling, she always turned towards him. And so fast forward 4 years, she was feeling that the Lord wanted her to start an official ministry for women who have experienced infertility, miscarriage, stillbirth, death of a child. And she asked me to write and teach a curriculum for that ministry. And so we have started a ministry called Grace Beauty that meets at our church. And Grace Beauty is in honor of her daughter, whose name was Annabelle, which means grace and beauty.
Oh.
And
I
so
didn't know that's why you named it that. That's beautiful.
yeah, it's become a beautiful community of women where women can come without judgment, without fear of what someone else is going to think. Everyone there has experienced some type of loss or infertility. We have small groups for each of those different categories, and every leader has personally experienced one of those things. And so when people come, I think it's just a safe place for them to feel heard, to feel like they're not alone. We want to help people learn how to lament well. Lament is just a fancy word for crying out to God in your grief.
Yeah.
And to learn how to engage with God rather than raging against God, to turn towards him rather than turning away from him. Even when you have those strong emotions and you're questioning and you have doubts about why would God let this happen? So that's one of our goals. We can't answer the why questions, but we can introduce people to God, maybe in a surprising way, maybe in a way that they've never thought of him before, and try to answer some of those questions that they might have.
You know, I think a lot of people, just because of the way church works, like we kind of expect in America to go to church and be happy. You're supposed to be happy, put a smile on. How you doing? Blessed and highly favored. Thanks. Better than I deserve, all that stuff. And so we don't have a language to share our anger and pain with God.
Right.
We feel like we have to hide it from him, even though he can see it.
Right.
And so it sounds like you create that safe space where you can go, no, it's okay. We're going to go to God together with our pain.
Yep.
We don't have to be ashamed of it.
Absolutely.
What did it feel like when your friend asked you to do this?
I was open to it, but I was very cautious at first. I just felt like I'm not an expert in this area, and the Lord really, he put some things in front of me it was very clear. You need to do this. I'm asking you to do this, and I'm going to equip you to do this.
I love when the Lord does that, where he calls people.
Yeah.
And we often can't see those in ourselves, but Sarah and I know you well enough to know, goodness gracious, you have a master's in biblical counseling. You've been through this yourself. You're the perfect person to be doing this. So I love what the Lord's doing through you all in Grace and Beauty. So if folks want to be a part of this, I can guarantee we have women listening who would love to be part of a support group for someone who's been through this kind of loss. Tell us about the church and when this meets, where it meets, all that stuff.
Yeah, so we meet the first Saturday of every month. So we'll be meeting this Saturday. And we meet at Maranatha Bible Church, 9 a.m. And you can get information on our website, mbc95.org, and just click on events. We also have an Instagram, Grace Beauty Ministries. So you can check out information on the Instagram, and there's links there where you can get some of the details about the meetings.
And for those who don't know, where generally is Maranatha Bible Church?
In the Akron area.
Akron area. Yeah. Easy to get to, big church. And you can just show up. You have to sign up.
Nope, there's no registration. You can just show up, and we'll get information from you when you come.
And we love talking about resources like this because, like, for example, we have a men's recovery group that we talk with Roy from Galvanized a lot. And guys show up and go, hey, I heard you on Moody Radio, and I came. Like, you can easily go and say, I'm here to see Erica.
Yeah, absolutely.
I heard her on the radio.
Yep, I'd love to greet you and love on you, and there's lots of women there that will love on you as well.
So please consider going to Grace and Beauty to get the support you need, ladies. This is a painful thing, and you shouldn't be alone. The Christian community is designed for us to bear each other's burdens like this. Yeah. If you've been through infertility, miscarriage, stillbirth, death of a child, there's a safe place for you to go. It's at Maranatha Bible Church in the Akron area, mbc95.org. Yeah?
Yes, that's correct.
mbc95.org, or on Instagram, look for Grace and Beauty.
Grace and Beauty Ministries.
Grace and Beauty Ministries. Wonderful. Again, we've been spending time with Erica Kurcsak. Her husband, Nathan, is a Moody grad, by the way, and one of the pastors at the church.
Yes.
But I don't like labeling women pastor's wife. I don't like doing that. So she has, a bachelor's in psychology from Cedarville and a master's in biblical counseling from Westminster Theological Seminary. Thank you so much for your time today, Erica, making the trip into the studio.
Yep. It's been an honor.
And Sarah and I thank you and your husband for your friendship as well.
Likewise.
It is just about 7:30. Speaking of issues related to pregnancy, postpartum depression is another really important thing to discuss. We have a couple of experts to help discuss that very issue here in just a few minutes. 7:35, Mornings with Brian, WCRF. Ladies, don't forget the Renew Women's Conference is coming up here in just a couple of weeks. Saturday, September 16th, Canton Baptist Temple. Would love to see you there. We're not going to have Lauren with us this year, which I'm nervous about. Usually, Lauren's the one that makes sure that I behave and know what I'm doing because I kind of wander around. And we'll just see what I guess Daria will have to
Yeah, she can do it.
help make sure
I don't know what I'm doing either. I started in June.
Well, you and
Just
I
make
can
sure
just...
Brian, just make sure he's sitting where he needs to
Make
sit.
him behave.
Yes.
Yeah, essentially.
Don't let him leave the worship center. He just has to sit there. So he's always there.
But now you are with child, due very
I am.
soon.
Yes.
It's amazing to me when I talk to somebody at your stage of pregnancy how different things are, even from when Sarah and I were having when Sarah had kids. I just stood there.
You were just there. Yeah.
We talked a little bit about postpartum depression and like anxiety, but it wasn't really, people didn't pay that much attention. They'd be like, hey, that's a thing. You better be watching for that. Okay.
Mm-hmm.
And then we move on. Did you have any experience with that when Trey was born?
Not postpartum depression, but I was for sure had some postpartum anxiety, mostly around like sleep. And so much so that I was like, I need to get this child farther away from me at like bedtime, like sleeping, because it was just causing a lot of problems. I had very vivid visions of like a strange man crawling into our room, trying to snatch my baby out of its bassinet.
Ooh. Oh, scary.
I would wake up several times a week and like in a panic looking for our son in our bed, and he would be in his bassinet, like waking up Eddie in a panic, like screaming, yelling, where is he? Where is he? And he's like, dude, he's in the bassinet. So it's just a lot of anxiety around sleep and his, safety.
How did you connect the dots that it was postpartum?
Well, my sister has had 3 kids and she's also a therapist. And so I talked with her a lot about it, and just knowing like, oh, this does not feel normal. This does not feel like how it should be. I don't think other people are doing this every day, like panicking about where their baby is or that there's a man crawling in their room. So just, some signs of like something is a little off here.
Melissa Brown is with us now from Cedarville University, where she is a professor of social work. Melissa, postpartum depression is no joke. There's serious emotional impact here. Does Lauren's story surprise you at all?
Not necessarily. The March of Dimes indicates that as many as 1 in 7 women experience postpartum depression. Wow. So chances are we all know someone who has experienced postpartum complications.
Now, what are some of the ways we can recognize whether it's just like, oh, she's tired because the baby doesn't sleep much, versus there's actually something clinical going on here?
Sure, and that is
7:49 WCRF, Mornings with Brian. We've been chatting with our friends from Cedarville University about postpartum depression, such an important topic that followers of Christ don't discuss enough. We've been speaking with Melissa Brown, assistant professor of social work at Cedarville. Her colleague, Dr. McKenzie Grinalds, is with us as well. And she is professor of graduate pharmacy program at Cedarville University and works as a clinical pharmacy specialist at a hospital in Dayton. Thank you for joining us as well, Dr. Grinalds.
great to be here. Thank you.
So in the area of postpartum depression, since you're the pharmacy person and I'm not very sciencey, safe to assume this is neurochemical and or hormonal as opposed to just situational, yeah?
Yes, absolutely.
So to what is like chemically causing postpartum depression in women who've just given birth?
Yeah, that's a great question. I think it's more, at least medical providers wish we even knew more, but there definitely is, there can be hormones at play. There can also be an imbalance of neurotransmitters in the brain. This medication that we're going to be talking about, zuranolone, affects a neurotransmitter called GABA. And so because of the impact that this medication can have on symptoms related to postpartum depression, this neurotransmitter is thought to be one of others that could be having an imbalance during this time. There's other neurotransmitters, if we want to get fancy and talk about serotonin and norepinephrine, which are the targets of other antidepressants that we can use to treat postpartum depression as well.
But of course, I mean, everything, including rides at like Chuck E. Cheese, say you can't be pregnant and be on them. And so it's like the idea of a treatment chemically and through medication for postpartum depression sounds great to me. But how are you going to convince women this is safe?
Yeah, absolutely. I think it's wonderful how women are, God designed us to want to protect our babies.
Yes.
And so this is definitely a conversation to have with your husband, your church family even, and then your medical provider to see if this is a good option for you in light of the significant symptoms that might be affecting her ability just to care for the baby and herself during this time, as Melissa had alluded to before. And so other treatment options are kind of long-term. You have to take them every single day. The newest, or before zuranolone, there's a medication called brexanolone. It's a cousin of this newer medication, and it was only administered for 5 days as an IV infusion at a hospital. So that was a kind of a step forward, because we would only have to treat someone's symptoms for 5 days and see lasting benefits. Wow. And so that medication would be out of the patient's system, and then we wouldn't have to worry about potential negative effects to baby or during breastfeeding. With zuranolone, it is an oral medication, so a woman doesn't have to go to the hospital to receive this medicine. You can take it once a day for 2 weeks, and then you're done. And you see lasting improvements in mental health symptoms for weeks after that. So that's a positive thing about this medication that can maybe be one of the considerations for women who do desire to breastfeed and yet still might have severe enough symptoms where treatment with medicine might be an appropriate option.
And this new medication, is it available now?
It is going to be available soon. The FDA just recently approved it, and so it is a discussion that OBGYN offices are aware of and might be able to connect their patients to, but it is very, very new, hot off the press.
Now, what's the consensus among pharmacies, among pharmacists about this medication?
Well, I guess I shouldn't speak for all pharmacists.
Or at least for you. How about
that? I would say that this is a promising option for women who have really severe symptoms that are impacting, like I said, their ability to care for themselves and others. But with all medication, there are definitely risks, and this medication is no exception. There are positive benefits, but for women who are maybe taking other medications that could interact with this might not be the best option, or maybe they are really concerned about the impact on breast milk. At this point, we don't have a lot of data about what the impact could be on the baby. There, in the limited studies that have been done in lactating women, we see only a little bit of the medication that gets into the breast milk. But again, that would be a discussion between the provider and the patient. And if even just for that short window, could she maybe pump and then discard the breast milk? So there's lots of things to consider. If it's recommended not to drive for 12 hours after taking the medication, because it can cause you to be more sedated. And so there are risks. I make it sound kind of scary, but at the same time, there are definite benefits, recognizing that you only take this for 2 weeks and can have lasting benefits as well. So I think for me, I'm interested to see how this medication works and impacts women just outside of the clinical trial setting. But there definitely seems to be a lot of promise with medicine.
You know, I think most people interact with their local pharmacist more than their physician. If a woman's listening who wonders whether she may have postpartum depression, to what extent are pharmacists comfortable answering questions about that?
That's a great question. Every pharmacist is going to maybe have a different level of comfort with that. I think it could be at least a great place for women to start, asking if the pharmacist has any knowledge about this or even the time. I know sometimes smaller pharmacies, independent pharmacies, or maybe that are privately owned, those pharmacists might have a greater opportunity to talk with the patients that come up and who have concerns. So if you, especially for women who already have an established relationship with a pharmacist, that can be a really good way to get connected to care and maybe get some resources to help them break down any barriers to getting the help that they need.
We've been having a great discussion this morning with Dr. McKenzie Grinalds from Cedarville University in the pharmacy department, where she is professor in the graduate pharmacy program. Also, assistant professor of social work at Cedarville, Melissa Brown. Thanks to you both for your time today and your expertise. We super appreciate it.
Yeah, thank you for having us.
And before we let you go, Dr. Grinalds, I have to ask, do you guys have to memorize all those medication names?
That is a wonderful question. I would like to, I'll have to be honest and say not specifically, but once you practice in a given area and you see these medications over and over and over again, that repetition definitely helps you remember.
Why do you guys come up with all the weird names? Can't you come up with something easier?
That's a great question, but there are so many medications now. It is a little bit hard to try to think of new names, and it isn't. I will say it isn't the pharmacist who's making up those names. So we're on the same team as you guys.
Blame the drug companies then, I guess.
How to pronounce them too?
Yeah. Do you have a favorite, like a super long one that is hard to say?
Ooh. So a medicine I deal with a lot is a seizure medication called levetiracetam, or Keppra is the brand name. So most people call it Keppra, but I like saying levetiracetam.
Nobody can pronounce that. Are you
Sounds like
even pronouncing it
wizardry.
right?
Well, there is another camp that calls it levetiracetam, and I think the other version just rolls off my tongue a little bit sweeter. So. Yeah. I'm biased in that direction.
All right. Thank you both again for your time today on this really important subject and for my unimportant questions at the very end. Really appreciate that.
Thank you.
God bless you both. Our good friends at Cedarville, they're such a great resource for us. Mm-hmm. I always feel embarrassed when I have to ask about a medication. You're like, what kind of medication is your child on? I don't, something with lots of consonants.
Yeah, it's true. There's not a lot of vowels in there usually.
They always want to know the birth date.
Like PFZYR. You're like, man.
Yeah, it's the sulfoxafenilpanine.
There's X's in there. Like, who uses X's?
Yes.
You know?
One of my kids on medication with an X. Who does that? It's not a xylophone. It's the only X word anyone has is xylophone and X-ray.
That's right.
All right. Well, we've got that all figured out. And thank you for bringing up that subject. Were it not for our good friend Lauren, we wouldn't have been talking about those things. I wish we would have talked about postpartum depression and miscarriage and such much more often on the show. This is why it's so good. We've got some real smart, strong women on the team.
And if you want to listen to these conversations later, I will be posting them either later today or sometime tomorrow. So look for those if you missed anything.
Oh, great. Thanks, Both conversations, right? The one about the support group.
Yes.
Okay, great. So anything you've heard in the last hour is going to be available online. Thanks to Daria. Just go check out our social media pages, Daria, for that.
Facebook and YouTube, it will be available.
Facebook and YouTube. Thank you so much. Okay, it's 8 o'clock. It's time for Ron's News and today's More Ron moment. And we're not too far from Dave Safransky, president and founder of Edgewater Investment Group, here to answer your financial questions. Get in line right now, 440-546-2255. Call or text 440-546-2255.